And here to talk more about the changing landscape of health insurance is Greg Garthwaite. He's assistant professor of management at Northwestern University's Kellogg School of Management, and he specializes in healthcare. Craig, welcome. Good to have you with us. I assume you heard Scott's package there. I'd like to get your best guess, your estimate of how much or what percentage of the premium increase I may get next year in my company plan is attributable to the Affordable Care Act. Is it 20%, 50%, 80%? What?
So I really don't have an exact number for that, but I think what we are seeing is that there's going to be a mixture of two things that are causing premiums to go up. One is that we're coming out of the recession, so health spending is going to start to increase again. We've had relatively low increases in health spending over the past 2 years as a result of the recession. And the second is that a lot of company plans have to be more generous to meet the minimum standards under the Affordable Care Act. And those are the two primary drivers of increased premiums in the workplace.
The other thing that a lot of people are asking questions is, whether you work for a company, a big company, a small company, or no company, that ultimately every American person is going to have to sign up for these healthcare exchanges. Is that a good thing? What are the pros and cons of that?
So I think certainly what we'll see is that a lot more people who are in employer coverage now are going to move into the exchanges, and that probably will be a good thing for them. But these are going to be people who are eligible for thousands of dollars in subsidies from the federal government. And now that they get their insurance not from their employer, they'll be free to move across employers, move from a large to a small employer. There'll be lots of benefits there.
Aren't there also some downsides to that too?
Yeah, well, the downside certainly at a minimum is going to be that the cost of this bill is going to end up being far greater than we ever estimated, and that's going to come out of every individual American taxpayer. And we're just not, I don't think we're adequately preparing for the increased cost of the ACA.
So is what you're saying, Professor, that more and more companies will get away from offering health insurance as a primary benefit to their employees, big companies and small companies?
Yeah, I mean, I think what we'll find is that if you have a lot of low-income employees, if you give them health benefits, then they're ineligible for all these subsidies that President Obama keeps talking about. For a family of four, you could be talking about a subsidy that's upwards of $13,000. And so it's going to be a change in the paradigm of the employer that a lot of what we used to think of as good employers, it might be better for them to not offer insurance to their employees and let them qualify for these federal subsidies.
Now, the whole premise of this Affordable Care Act is to get healthy young people to sign up for the program. The way things are going, do you see that happening? And if it doesn't, what does that mean for the whole financial, the financial health of this health care plan?
I mean, that's all going to hinge on the website. And that's really, from my view, the primary reason why Sebelius should have been apologizing today, because if we don't get that website working, we don't make it easy for people to sign up, then the people who least want health insurance, who are going to be the young, healthy people that Susie's talking about, those people are not going to sign up. And if we don't get them into the pools, then all we're going to do is have a series of exchanges that have relatively old and relatively sick people. And the economics of the Affordable Care Act just don't work without young, healthy people being in the insurance pool.
Your very quick opinion, is disconnecting health insurance from employment a good thing ultimately?
Yes.
All right, that was a quick answer there. Craig, thank you very much. Craig Garthwaite, assistant professor of management at the Kellogg School at Northwestern.